Hi guys, welcome back again. Today I'm gonna talk to you about head and neck examination. Let's start. Okay guys, so let's start with the head and neck examination. Before that, as I said in the previous video, we have to start with this term, which, okay, in any examination. W standing for wash your hand, introduce yourself, take a permission from the patient, E for explain what you're gonna do for the patient, SH for shaking the patient's hand, and then you're gonna inspection, palpation, percussion, and auscultation. Okay, here in this examination we are going to do all of them. Okay, and then before you will start, ask the patient to sit in the chair. Okay, and then we will start with the inspection. In the inspection of the head and face, we have to look for these terms. Okay, skin color, pigmentation, any lesion, hair distribution, xanthelasma, and eyes, mouth, nose, ears, and cachexia with dehydration and discharge. Okay, so let's focus on color of the skin. We have to look for yellowish discoloration or not. Okay, it's present or not, pale or not, pallor look in chronic illness also. The melasma usually is seen in pregnant women, malar flush in a case of for SLE, systemic lupus erythematosus, and looking for telangiectasia, okay, and for polycythemia rubra vera, seen in which is a cherry skin. Okay, it's very important to looking for this as I mentioned it. Okay. And then for any pigmentation in the face, okay, any dark spot or others, okay, and then any lesion, hair distribution is very, very important, okay, because it gives a clue about disease, okay. So you have to mention there is evidence of loss of hair or not, okay. For example, patient with hypothyroidism, loss of outer eyebrow, okay, and has thick hair also, while patient with hyperthyroidism, loss of scalp, okay, scalp hair, just like alopecia, which also alopecia you have to mention if it's present, it's an autoimmune disease, okay. And then we are gonna xanthelasma. In the xanthelasma, which is indicate for hyperlipidemia, okay, and then we have eyes. Before we'll jump to eyes, mouth, nose, and ears, you have to look for the patient for cachexia and dehydration with discharge, okay. Discharge is very important to detect it, and the site of the discharge with color, okay, color of the discharge, it's mixed with blood or not, okay, and the color of the discharge, as I said, is very important, okay. And then we are jump to this one, eyes. We are looking for shape and size. It's very important. About eyes, a sleepy eyes, for example, in hypothyroidism, we will face it, and a bulge in shape we'll face in thyrotoxicosis. While in a case of the Down syndrome, which is a congenital syndrome, it seems slanted eye, okay. And then we are gonna this four terms, which is very important. You have to mention exophthalmos, lid retraction, lid lag, and puffiness of the eyes. Exophthalmos. So what's exophthalmos? Let's focus on it. It's abnormal protruded to eyeball, but why it occurs? Okay, why? What's the reason? So because of fat deposit in orbital space in a case of thyrotoxicosis, which is irreversible, okay. We can examine a patient by minor, moderate, and or severe in a case of exophthalmos, because it has three corners of severity, okay. In a minor, we will stand behind of the patient, which has a specific name called Navziger sign, okay. And in a moderate case and severe, we will stand at lateral position of the patient and the sign called Jeffrey's sign, okay. We will face no wrinkles in severe case of exophthalmos. Okay, and then we'll jump to lid lag and lid retraction. Lid lag and lid retraction. In lid retraction, so what's lid retraction? Lid retraction is upper lid is far away from sclera, okay, due to hyperactivity of upper lid muscle, okay. And then we have lid lag. In the lid lag is a delay of upper lid. It can't follow sclera. So why it occurs? Because due to over contraction of levator palpebrae superioris muscle, okay. And then we have puffiness of the eye. Puffiness of the eye usually seen in hypothyroidism, although may occur in other diseases, okay. And then we have chemosis. In the chemosis, which is a swelling of conjunctiva and then ophthalmoplegia. In ophthalmoplegia, so what's ophthalmoplegia? Because of other deposit fat, so it presses on oculomotor nerve. So in a certain movement, a patient develop double vision. Okay, this is a ophthalmoplegia. And about color, you have to mention. Okay, color is very important for yellow, for example, which indicate for a jaundice, and pale for anemia. And then any findings of the eye. Okay, like for example, arcus senilis. Arcus senilis, which is a white ring outer eyeball, which seen in diabetes mellitus and atherosclerosis also. And other finding, like for example, Bruchfeld spot. Bruchfeld spots are small white or grayish brown spots, okay, on a periphery of the iris in a human eye due to aggregation of connective tissue, a normal constituent of the iris stroma in a case of Down syndrome, okay. It's very important. And the last one is ptosis. So what's ptosis? Ptosis is another finding of the eye if it present, okay. So you have to mention it if it present is dropping or falling of the upper eyelid caused by stroke, brain tumor, or due to dysfunction of what we call the muscles, okay, that rise the eyelid or their nerve supply, oculomotor nerve for levator palpebrae superioris, and the sympathetic nerve for superior tarsal muscle, okay. This is all about eyes, okay. And then let's jump to mouth. In the mouth, we are looking for central cyanosis. Central cyanosis is a blue discoloration seen on the tongue and lips, and is due to lower level of oxygen in the central artery blood caused by cardiac or respiratory disorders, okay. And then we are looking for pursed lip breathing, okay. Pursed lip breathing is very important. Why? Because seen in asthmatic patient or COPD, chronic obstructive pulmonary disease, especially in emphysema, okay. This is very important. And then we are looking for dorsal surface of the tongue, which in normal state should red to purple in color, while when it covers by yellowish discoloration seen in smoking. And also we are looking for dehydration, also dorsal surface of the tongue. And then we have angular stomatitis. In angular stomatitis, usually due to iron deficiency, anemia, and we have glossitis for B12 deficiency, also any ulcer may indicate for Crohn's disease or Ephthas ulcer also, or any ulcer that relate to mouth, okay. And then we have hygiene. You're looking for good or bad, okay, you have to mention, okay. And then ankylosing, another one which ask a patient to lift tongue up, okay. And then you're looking for ankylosing. And then we have cleft lip, okay. And then odor is very important, okay. I wanted to stay in this point. Odor is very important because there are a lot of disease may diagnose it with odor, okay, or give a clue about disease. Like, for example, acute renal failure can cause the breath to smell like ammonia, okay. Acute liver failure, mousy odor. DKA, acetone odor, okay. DKA mean diabetic ketoacidosis. Appendicitis, fecal odor. So it's very, very important, okay, to recognize all of them. And then we have oral candidiasis. In oral candidiasis, you have to measure. It's very important due to, for example, fungal infection and other causes. And slow speech also in another indicate for hypothyroidism, for example. And then we are jump to nose. In the nose, very important. We are looking for shape, color, nasal bridge, polyp, and nasal congestion. Okay. So you have to mention if it present any abnormality. And so shape of the nose is symmetrical or asymmetry or not, okay. Color, I mean skin average. And then nasal bridge is very important because in a case, for example, Down syndrome, you'll face a flat nasal bridge, okay, flat nasal bridge. So it's important to mention. And then we have polyp. In the polyp is as I mentioned it in the last video about asthma, with asthma there is present of polyp or nasal polyp, so it's important to mention, okay, and looking for. And then we have nasal congestion. In the nasal congestion, ask a patient to blowing the nose to detect congestion or not, okay. This is very important to detect. And then we are jump to air. In the air, we are looking for shape, abnormality, congenital abnormality, air tags, and any discharge, okay. It's very, very important. So and then about the shape, it's normal or not, is I mean it look at the normal line or upper than normal line or lower than normal line, okay. It is small or large, okay. And then we are looking for any abnormality, any congenital, any air tag is very important, very common also, okay. And any discharge. In the discharge, you have to mention the color of the discharge and site of the discharge also, okay. And then we are jump to neck. In the neck, we are looking for JVP, scars, swelling, vein, position of the trachea, and pigmentation, mass, and lymph node enlargement, lesion, and thyroid, okay. And about JVP, which is very, very important to mention, is due to thoracic vein obstruction, or in case of core pulmonary you will face, okay, or it has other causes, okay. And then we are looking for skull, may indicate lymph node biopsy or surgery, okay. Lymph node biopsy or surgery, maybe scar. And then you are looking for swelling, if it present, okay. If it present, ask a patient to swallow, okay. Ask a patient to swallow if up and down relate to thyroid enlargement also. And then we have vein. The vein as a JV distension in a case of volume overload, or in a case of AF or heart failure distended also, okay. Vein. We have position of trachea, is very important. It is centrally located or shift to right or left, okay. It's very important to detect. And then assessment of range of motion of the cervical spine is another one which you have to perform. And pigmentation, any mass, lymph node lesion, and thyroid. Here in the thyroid is very, very important. I want to stay here, focus on it. And in the thyroid inspection, the thyroid gland is located below the thyroid cartilage, okay, and is normally not visible. In front of a patient, we will stand and ask to swallow, okay. It seems thyroid cartilage move, okay, up and down. If it attached to anything, it nicely move with it, okay. That's all about inspection of the face and eyes, mouth, nose, ear, and neck, especially in thyroid. And now let's jump to palpation. Okay, in the palpation of the face, we are looking for temperature. Okay, you'll palpate the face for temperature, anemia also. In anemia, ask the patient to look up while you hold lower lid with your thumb. Okay, and then palpate skull. Okay, palpate skull, especially if patient complains of tenderness or recent trauma. And then we have air in the and before that, assess facial sensation and motor function also. Okay, this is very important. And air in the air for patient complaining of ear pain or discharge, gently move the auricle up and down. Okay, and apply pressure to the tragus and the mastoid process also. This is about palpation of the face. And about neck, is very, very important. Palpate lymph node. Okay, don't forget, please. In the neck, as you know, you have to palpate, and lymphatic drainage of the neck, lymphatic drainage can be divided into two circle and two column. Okay, one of the circle and one of the column is deep and other is superficial. So what about superficial ring? In the superficial ring, or what we can say circle. Okay, so superficial ring, we have submental, submandibular, preauricular, postauricular, and occipital. These are belongs to superficial ring. And then we have superficial column. In the superficial column, all that located in the posterior triangle. Okay, in the posterior triangle. And others which is deep, we have ring and column also. In the deep ring, we have a peritonsillar, tonsillar, paraesophageal. Okay, which is non-palpable, but is except the tonsil, which is palpable also. And then we have deep column. Deep column, we have jugulodigastric, supraclavicular, and jugulo-omohyoid. And then we will examine thyroid. We will examine thyroid by two ways. One is in front, and the second one is behind the patient. Palpate gently, okay, and detect lower margin of thyroid. Okay, and then the normal thyroid is usually not palpable, although in thin patient may palpable. Not any asymmetry, okay, not any asymmetry or enlargement. And assess the mass, for example, if it present size, shape, tenderness, temperature, consistency. Move with swallow or not. Okay, move up and down with protruded tongue or not. This is very, very important, relate to the thyroid. If thyroid not clear, I can press one lobe and feel another one on behind patient position should perform it. Okay, we have mass. In the mass, before we will talk about it, you have to know differential diagnosis of midline mass and differential diagnosis of lateral neck mass. Okay, what about differential diagnosis of midline neck mass? We have the first one, thyroid isthmus nodule, move with swallowing. Okay, and then we have the second one is thyroglossal cyst. So what's the thyroglossal? So thyroglossal cyst, thyroid on embryonic life, it is at the posterior part of the tongue. So when we have lingual thyroid, this is thyroid fall. Okay, this is thyroid falls to descending. It will located just posterior to the tongue. So the thyroglossal duct falls to closure. There will be formation thyroglossal cyst. So this is the second one. And the third one is lipoma. The fourth one is sebaceous cyst. And fifth differential diagnosis is submental lymph node or abscess, and lingual cyst also in another differential diagnosis. And then we have differential diagnosis of lateral neck mass. We have cervical lymph node, I mean inflammation or malignancy or chronic infection like TB. Okay, the second one is lobes of thyroid, move with swallowing also. The third one is parotid gland. The fourth one is submandibular gland. The fifth one is very important, cystic hygroma. So what's cystic hygroma? Cystic hygroma, it's a congenital swelling, usually occur at lateral aspect of the neck. Child mostly in the first year it occurs in lymphatic canal. Okay, lymphatic channel. Usually in embryonic life, it separate from each other and then will be communication. Okay, when there is growth of lymphatic channel fail, okay, to communicate, causing group of lymphatic canal filled with lymphatic fluid. So what are the pathognomonic for cystic hygroma? We have two pathognomonic. Okay, it's very, very important to know, which is the first one is increase in size with crying, okay, because pressure on lymphatic channel is increased. The second one is transilluminated positive. When you put a torch or a posterior aspect of it, cystic hygroma will be lighted. Okay, this is the fifth provisional differential diagnosis. And other one we have carotid artery, I mean carotid body tumor or aneurysm. It's either pulsatile or transmitted pulsation. Okay, you have to exclude. Okay, and then we have lipoma also, sebaceous cyst also, laryngeal pouch also, and bronchial cyst also. Okay, you have to put all and in the differential diagnosis of lateral neck mass. And then we have to jump to this term. In any mass you have to describe with this terms, which is very, very important, which are include 5S to TFCE. Okay, 5S belong to size, shape, skin covered and surface. Okay, and then we have 2T, temperature and tenderness, and A for fluctuation. Okay, C for consistency of the mass, E for what we call age of the mass. Okay, you have to describe mass by these letters. And then we are jumped to percussion. In the percussion, how can we be sure there is, for example, retrosternal extension? Because in the percussion you will perform to exclude retrosternal percussion, which is dullness, a large due to a large thyroid mass extend posterior to the manubrium. Okay, so how can we be sure there is retrosternal extension or not? Okay, we have to put 3 points in our mind to detect it retrosternal extension or not. Okay, which are, first one is dullness of percussion. The second one is Kocher sign. You will perform hand on one side of gland and he develops stridor due to tracheal compression. The third one is on swallowing, can't see lower margin of thyroid. Okay, by this what we call point, we can be sure. Okay, and then this is all about percussion. And then we have auscultation. In the auscultation we will perform to brood if there's present, indicate for thyrotoxicosis and carotid tumor or aneurysm. At the end, I wanna tell you red flag signs and symptoms of head and neck. Okay, let's talk about face. Okay, quickly recap. Okay, face. In the face, for example, loss of red flag. Okay, red flag. Okay, about face. In the face we have loss of cranial nerve function made due to cranial nerve paralysis or ischemic stroke. Okay, and about eyes. Okay, we have ptosis with incomplete lid closure due to cranial nerve pulses. Okay, and ischemic stroke also. And xanthelasma. Okay, xanthelasma made due to hyperlipidemia. Exophthalmos due to Graves' disease. Yellow sclera jaundice. Okay, conjunctival injection or what we call conjunctivitis, okay? Inflammation of conjunctiva, okay? And then we have conjunctival pallor for anemia, Horner syndrome for arterial dissection or tumor, okay? This is all about eyes, red flag. And we have mouth. In the mouth we have angular stomatitis or of iron deficiency, and we have tonsillar erythema for acute tonsillitis, and we have raspberry tongue for scarlet fever, and we have vesicles blister all. We have in a case of herpes virus infection, and we have, for example, tongue coating leukoplakia and oral candidiasis. So it's about mouth, okay? And then we have ears, red flag about ears. We have hearing impairment, okay? Hearing impairment due to hearing loss, okay? And then we have pain exudate due to ear infection. And then about lymph node. In the lymph node, enlargement lymph node may due to various or see in enlarged lymph node, okay? And then about neck. In the neck, red flag is JVP distended, okay? JV distended, volume due to volume overload and heart failure, as I said. And then about thyroid. In the thyroid, we have gland enlargement may due to goiter and thyroid cancer, okay? These are all about how to examine head and neck, okay? Inspection, palpation, percussion, and auscultation. Please don't forget all of that I mentioned in this video. I hope you got a benefit from this. Thank you for watching this video. Don't forget to make dua for me. Thanks.